Hi everyone, it's Dr. Jackman here, and I'm here just to say that I'm going to continue my egg freezing journey. I know that it's been a while, I've just had a lot going on, and I wanted to complete it. It's almost over, trust me. So, the next video I'm going to make right after this is basically telling about the process of egg freezing. I am going to go in depth with an explanation, so it may get a little confusing. Let me know if you have any questions when you see that video. But a brief overview of the process of egg freezing is that you will have to take medications to stimulate your ovaries to produce a lot of follicles, and we expect and hope that each follicle has eggs in it, or at least the majority of them. So your body naturally wakes up a certain amount of follicles every month, but typically only one will get big on a natural cycle. Only one will get big and ovulate and produce the egg, right? So when we give you IVF medications, it's to stimulate all the follicles your body woke up, so that we try to get as much follicles getting big and as much follicles having mature eggs in them as opposed to just one. So the first step is stimulation of the ovary to grow as many follicles for that month as possible. Two, you will be monitored by ultrasound and blood work throughout that stimulation, because we can't just give you medication and just turn a blind eye and be like, oh, let's see what happens. No, you're monitored frequently through that process. And usually you're on stimulation medication, I would say anywhere from like 8 to 12 days. And it kind of depends on your cycle as well, but typically I would say that's about 8 to 12 days, and you're being monitored during that time. Third step is that when a lot of the follicles, the majority of the follicles are big, like over 18, somewhere between 18 to 22 millimeters. I mean, that's big for a follicle. It's really small, but it's big for a follicle. So when you have your follicles reaching that size, we give you something called trigger medication. This is a medication that helps the egg inside the follicle mature, and that egg needs to be mature because only mature eggs could be fertilized. So that trigger medication, which is naturally in your body does the triggering with a hormone the brain produces called LH. We do the triggering with Lupron that tells your brain to secrete the LH, or we do it with Ovidrel, which is beta ATG, the pregnancy hormone that sits on the same receptor and stimulate the ovary to begin the maturation process of the eggs. Okay, so that's the trigger medication. So 3, you get the trigger medication. 4, you come in for a minimally invasive, that's not the right word I want, but anyway, a minimal procedure of egg retrieval, and that's basically done by, if you imagine this is you in your pelvis. This is the vagina, as I mentioned. This is the vagina. This is the cervix, which is the mouth of the uterus. This is the uterus. And these are the ovaries here with the fallopian tube. So imagine the transvaginal ultrasound. It gets placed in the vagina. And we just aim it towards the ovaries. So now the image on our screen, if I have a screen projecting this image on the ultrasound, is looking at this ovary. And then there's a needle that usually is attached to this ultrasound, and we can just guide the needle towards the ovary into a follicle and basically suction the follicular fluid, which will have the eggs in it. So we literally suction out all the follicles we find in the ovaries on both sides. Most centers do this with the patients asleep under light IV sedation. I did work for a center where I did most of these procedures awake, which was pretty interesting to learn, and actually really cool to be able to have that option. So we retrieve the eggs, so that's the fourth step of the process. Then an embryologist takes all the fluid that you gotten in your egg retrieval process, and they look at the eggs and they make sure that the eggs are mature simply by checking for something known as the polar body that says the egg is mature. And then it looks generally at the state of how the egg looks. You really can't tell quality of an egg nor sperm, to be honest. What you can tell though is just the general overall appearance, that the physical appearance that you could immediately see under a microscope. So your embryologist would look at all the fluid that was extracted and look for the eggs, count the eggs, and see how many were mature. And the last step would be to actually freeze the eggs. Now, freezing the eggs is not pushing it in a deep freeze. It's not slow freezing, because what happens if we did that, and we used to do that back in the days, not simplistically like that, but a similar process. But if you like look at water, if you put water in the fridge, it expands. Same thing used to happen if we do slow freezing with the egg. The fluid in it, called the cytoplasm, expands, and that could damage the cell membrane of the egg. So now we do a process called vitrification, and vitrification is a flash freezing with liquid nitrogen, like very quickly, and your egg gets preserved in its exact state, like a crystal ball. And that is perfect, because when you thaw those eggs, you get most of them, 95% of them, being great. So I'm going to explain this in more depth, but that was like a quick run through. But I am going to have a subsequent video explaining it into way more depth. The video may get a little confusing because I'm going to use technical terms, I'm going to use medication, but I will explain everything. And this is because some of my patients have been asking me for a little more explanation into things, because they're actually doing egg freezing. So this video was a quick overview that you get a basic understanding, and the next video I will upload will be more in depth in terms of the names of the medications, the types of stimulation, and the explanation as to how the medication works. I'm simplifying everything, but if it gets confusing in the subsequent video, just let me know and I will try to simplify it even more. So look forward to that second video. I hope you enjoy this brief overview and have a better understanding of what the process will entail, but I'm going to go into way more depth for a longer time in the subsequent video. Okay, I hope you have a wonderful weekend and a happy Friday. Stay safe, guys. Coronavirus is still a thing. Please wear your mask, practice social distancing as much as possible, and stay safe as much as you can. Okay, just remember, no touching of your mucous membranes of your eyes, nose, mouth, and keep sanitizing, okay, with soap and water if you have access to, or hand sanitizer. All right, so look out for that subsequent video. I will see you soon. Bye bye.